Good evening, everyone, and thank you so much for joining us in our special report tonight on artificial intelligence in public healthcare. My name is Emma Wu, and I will be your host tonight. And we're diving into how AI is reshaping the medical world, its promises, its pitfalls, and what it means for all of us. Think of AI in healthcare like a GPS for doctors. It provides direction but isn't infallible. During the COVID-19 pandemic, this technology played a critical role, much like a guide navigating uncharted territory. AI-powered tools such as contact tracing apps and predictive analytics helped governments and healthcare providers anticipate surges and allocate resources effectively. For example, according to a study by Elvey et al. In 2021, AI-based predictive models combine clinical and epidemiological data to forecast the spread of the virus and patient outcomes, enhancing decision-making and public health policies. Advanced neural networks also facilitated rapid diagnoses through medical imaging, while intelligent systems supported risk assessment and epidemic control strategies. Overall, we can see that these applications highlight AI's potential to revolutionize pandemic responses. Although challenges like data quality, ethical concerns, and model generalization are still preventing widespread adoption. And we can say that interdisciplinary collaboration is crucial to harness AI's full potential in managing public health crises now and in the future.
AI-powered systems such as HealthMap, founded by the Boston Children's Hospital, collect and integrate outbreak data from around the globe. They use machine learning algorithms and big data to assess how big a threat a given infectious disease is. He explains why AI is needed for this type of content scouring.
The vast quantity and heterogeneous nature of all this information is very difficult for humans to process, which is why this type of AI is needed to track exactly how, where, and at what speed new diseases are spreading.
Another striking example is how AI predicted infection hotspots, giving hospitals the data they needed to prepare. AI systems analyzed massive amounts of real-time data, such as travel patterns, population density, and reported case numbers, to forecast where outbreaks were likely to occur. However, DW's documentary, How AI Tracks COVID-19, also highlights a critical limitation of AI. It relies heavily on the quality and the completeness of the data it processes. For example, if regions lack precise testing infrastructure or have inconsistent reporting practices, the AI's predictions may become unreliable, therefore creating blind spots in infected areas. So, to compare AI, for example, to a GPS that can mislead a driver without updated maps, AI tools must carefully be monitored and supplemented with human oversight to ensure accuracy and effectiveness. Consequently, viewers, we can ask ourselves, how can we trust AI's abilities while carefully checking its results to avoid depending on it too much? In diagnostics, AI is a game changer. Imagine a tool that can detect various forms of cancer with the utmost extreme precision.
Yes, it is indeed. And you can see why two human readers would have just looked through, compared it. It looks very much the same and would have said that that's normal.
As highlighted by the BBC here, an AI tool tested by the NHS successfully identified tiny signs of breast cancer in 11 women, which had been missed by human doctors. This capability of AI significantly enhances early detection, enabling interventions that could save countless lives by treating conditions like breast cancer at an earliest stage. And it's not just in advanced hospitals. AI is breaking barriers in rural and undeserved areas.
Significant number of patients seeking care beyond their borders, and they should get care within their community. Currently, it's very difficult to do that just by training more doctors and building more medical schools or hospitals, because we will never be able to reach everyone everywhere. But if there was an AI doctor that can be with them and have the answers whenever they need them and where they need them, and having those answers being contextualized for that specific patient in that village, we would not see such dire consequences of years of underinvestment in health. I'm Mohamed Abrawi, a surgeon, and I have the privilege of leading our team at Speak Up, a digital health platform that connects patients in remote communities across the Middle East and Africa to physicians that understand their context language and are able to help them best.
For example, in the clip that we just watched of the TED Talk, Mohamed Abrawi highlights how AI-powered telemedicine platforms are revolutionizing healthcare access. These systems enable doctors to remotely diagnose and treat patients in remote areas. This innovation ensures that quality healthcare reaches even the most isolated communities due to geographic and resource limitations. And what about the planet? Training AI models isn't just expensive, it's extremely energy intensive.
Within Kathy's big question is a more basic one about how much electricity our digital lives require. At first, I was thrown off that Kathy mentioned things like cloud storage and AI and cryptocurrency in one category. But then I realized that their electricity demands happen at the same place: data centers.
Ultimately, you're talking about machines loaded up in large facilities who generate computations, and they need power, a lot of it. They need water, they need space.
Data centers, artificial intelligence, and cryptocurrencies made up about 2% of total global electricity demand. But by 2026, that number is expected to double, which is like adding the amount of electricity used by the entire country of Sweden. That big jump from 2022 to 2026 is thanks to rising cloud storage and cryptocurrency electricity demands. But it's also because of the AI.
Based on the Vox video, Can Clean Energy Handle the AI Boom?, we can observe how the rising demand for AI technologies, including those used in healthcare, significantly increases energy consumption, with data centers, cryptocurrencies, and AI projected to consume up to 4% of global electricity by 2026, which is twice more than in 2022. The increasing overuse of tools like ChatGPT contributes to the unsustainable use of global electricity due to the immense computational power required to process large volumes of chats in real time. As demand for these AI-powered applications grows, cumulative energy consumption rises, placing significant pressure on global electricity supplies. In healthcare, where AI-driven tools like predictive analytics and diagnostic models are increasingly adopted, this energy demand raises critical environmental concerns. While AI offers transformative benefits, such as improved diagnostics and accessibility, its carbon footprint highlights the need for more sustainable energy practices. Therefore, we can see that this provides a more critical perspective based on what we explored before, showing that while AI can enhance healthcare, its broader implications must also be addressed to ensure its advancements do not come at the expense of the planet. However, AI's future isn't just about technology, it's also about people. The Economist's video, Can AI Close the Healthcare Gap?, also reminds us that collaboration within different industries is key. For example, policymakers, technologists, and communities need to come together and collaborate to ensure that AI systems are inclusive and equitable, which means that it must be fair to everyone. So you may be asking, where do we go from here? Actually, AI in healthcare holds immense promise, but like that trusty GPS that we mentioned in the beginning, it's only as good as the people guiding it. So we should aim to steer this technology responsibly, balancing innovation with human ethics and sustainability. Thank you so much for listening. This has been our special report on AI in public healthcare. Thank you so much for joining us. I'm Emma Wu, your host, and we'll see you next time.